Okay, so now we're going to talk about client factors. Okay, so the 10 body functions that have the greatest impact on Quinn's feeding skills. So those would be higher level cognitive, so judgment, concept formation, metacognition, executive function, praxis, cognitive flexibility and insight, attention, so sustained shifting and divided attention, concentration and distractibility, mental function of sequencing complex movement. So the functions that regulate the speed, response, quality, and time of motor production, such as restlessness, toe tapping, or hand wringing in response to inattention. Memory, so short-term, long-term, and working memory. Perception, the discrimination of sensations, like auditory, tactile, visual, olfactory, gustatory, vestibular, and proprioceptive. Experience of self and time, so his awareness of his body and position in the reality of his environment and of time. Orientation, so orientation to person, place, time, self, and others. Energy and drive, so his energy level, motivation, appetite, craving, impulse control. Temperament and personality, so extroversion, introversion, agreeableness, conscientiousness, emotional stability, openness to experience, self control, self expression, confidence, motivation, impulse control, and appetite. And then lastly, proprioceptive functions such as awareness of body position and space. Okay, so how would we improve Quinn's fine motor coordination? So we could create a memory book, and this could either be with his wife or his kids and grandkids when they come to visit. And he could put pictures of his family in there to help him with remembering them or just remembering some of his memories from his past. Doing a small puzzle. The picture could be something he really enjoys or he likes, such as fishing or cars or anything. There's even some websites that you can use and you can create a puzzle with a picture, a personal picture. So that would be a neat option for him. Making a fine motor sensory pillow, mat, or a fidget blanket of some sort that is kind of able to fit over his wheelchair, kind of like the second picture right here. And it would have buttons, clasps, zippers, buckles, different textured fabrics on it, and so on. In some of the later stages of dementia, Quinn may start to experience greater declines in his reasoning and his language, but he'll still have his senses. So the sensory blanket can serve as a way for his caregivers to help connect with him, while it's also stimulating and maintaining his fine motor skills. And then lastly, we could make a tie blanket. Having to tie the little ties at the end of the blanket require fine motor skills, and this can be used as a fun activity, and maybe he'd be able to do it with his grandkids. What strategies would we use for his cognitive deficits? First, we could label or put pictures on his eating utensils, plates, cups, certain things like that, in order to help him identify and locate those items for a more successful mealtime. We could also create a routine of when and where his meal is taking place. That way, he's more aware of the routine and he's able to follow it. And the routine or schedule can also be visual and verbal, kind of like this picture here, just to kind of let it sit in more. And then lastly, we can limit the amount of items on the table at one time. So here in the picture, you basically just have the necessities. You don't have a lot of extra stuff. Maybe the mat might be a little bit extra, but we could also, when presenting him with food, just provide one thing at a time. So, for example, if he's having soup with a sandwich, maybe just give him the soup first with a spoon, and then you'll bring out the sandwich and whatever else is needed for that later, just so he doesn't have everything at one time. Okay, context and environments. Okay, so what are some of the environmental adaptations that would allow Quinn to self-feed more independently? So maybe allowing him to choose between two different meals would give him more independence and autonomy over his meals, and that would, like I said, help with independence. And then as well as providing the one food at a time, like I mentioned earlier. Maybe having him eat his meal in an environment with fewer distractions or noise, and that way it allows him to focus his attention on eating his meal, maybe a quieter side of the dining hall or in his room, or just something along those lines. And then lastly, using a high contrast colored dishes and utensils. So, for example, having a yellow placemat and red plates, silverware, cups, and things like that would create contrast that would bring the red out, and it would allow Quinn to focus more on what's on those plates because it would be more distinguishable from the yellow. Okay, and then adaptive equipment that would help self-feeding. So first, maybe like a scooper plate or a plate guard, since he was having problems scooping food and having it stay on there. The scooper plate or the plate guard would give him kind of like a barrier and help him scoop his food more efficiently and effectively. Next, we could try built-up utensils or maybe even weighted utensils, and this would allow him to just have a better grip on his utensils, and especially if as his condition progresses and he loses muscle endurance and strength, this would help. And then lastly, a cup with a lid and a built-in straw, maybe using the same red color, high contrast that we talked about, would allow him to focus more on the straw and drink from it properly. Okay, does food texture influence feeding, and does he need a change of texture? So texture can definitely influence self-feeding. Aversive behaviors can often result in decreased oral intake, nutrition, and hydration. And aversive behaviors can develop because of texture. And those kind of behaviors could look like needing frequent verbal cues, absent chewing or swallowing, refusing to drink, eat, pocketing, spitting out solids, or even clenching teeth. So a change in texture wouldn't hurt Quinn, especially if he starts to show signs that were becoming a problem for him, or starts showing aversive behaviors in feeding. So that could be an option, or at least changing his meals to finger foods and allowing him to eat with his hands, since he is more successful that way. And those kind of foods would look like bread, cheese cubes, tomato wedges, cucumber slices, apple slices, grapes, strawberries, just things kind of like that. Okay, how do we involve dietary and the nursing staff? So involving the nursing staff is pretty easy. We basically just want to explain to them the different adaptive equipment pieces that we got for Quinn and how they would benefit him, and just for them to continue to encourage him to use them and make sure that he's using them correctly with his meals. And then involving the dietary staff is also fairly simple. We just want to check in with them and see if there is a way to maybe either change the texture of his foods or just change his diet to finger foods, but we'd want them to make sure that he's still getting the necessary nutrients and balanced diet that he needs. Okay, other supports for Dorothea as Quinn's condition progresses. So we definitely want to help her find like family support groups, and a lot of the time they can be facilitated through the nursing home. And so helping her get in touch with the necessary people to get that going. Next we could suggest family counseling and just trying to involve maybe like their kids together and just get as much of the family as possible to serve as supports for her in this time, especially because it can be very isolating for her. And then lastly, there's different websites like the Alzheimer's Association and AARP, and they have, like I said, their websites. And AARP has many different resources for families, and it's a great way to really get connected with live chats and other things, and you kind of get to meet other people that are dealing with the same situation or similar situations. There's also an Alzheimer's organization specifically for Texas, so if they were here, like in Houston, that'd be a resource within our community that she could look at. And then lastly, any other disciplines that we would refer. So as Quinn's condition progresses, he may need to be referred to speech therapy as well, especially if he starts developing, like I said, any of those aversive behaviors, or just has a lot of problems with either his speech or swallowing. Speech therapy would take over on that.